Feeding a baby seems simple, but small mistakes can cause big problems. Many feeding issues come from lack of correct information. Bottle feeding may be needed when breast milk is not sufficient or available. Pediatric guidelines focus on safety, hygiene, and timing.
Bottle feeding itself is not harmful when done correctly. Problems begin when bottles are not cleaned properly.
Milk residue is an ideal place for bacteria to grow. Feeding safety starts with clean hands.
Bottles must be fully separated before cleaning. Rinse immediately after feeding to stop milk drying inside.
Use a brush to clean all inner surfaces. Nipples need special attention because holes trap milk.
Sterilization is essential for young babies. Boiling bottles for 5 minutes kills harmful germs.
Allow bottles to air dry naturally. Store sterilized bottles in a clean, covered place. Now let us discuss milk safety. Fresh milk must always be boiled before feeding. Boiling destroys bacteria that can harm infants. Milk should cool naturally before use.
Hot milk can burn the baby's mouth and throat. Milk should not be kept at room temperature for many hours.
Old or reused milk increases infection risk. Feeding the right amount is important.
Bottle feeding can cause gas if air is swallowed.
Proper burping prevents crying and discomfort. Feeding needs change as the baby grows.
Around 6 months, milk alone is not enough. This stage is called weaning.
Weaning introduces solid food slowly. Baby position is important to prevent choking.
Always start with very small portions. Solid food trains digestion, not hunger control. Watch for vomiting, rash, or loose stools. Milk remains the main nutrition during early weaning. Solid food slowly increases over months. Feeding utensils must be cleaned and sterilized.
Hygiene prevents stomach infections. Correct feeding supports growth and immunity.
Changes in stool may indicate feeding issues. Seek medical advice if problems continue. Proper feeding improves sleep. Clean surroundings support baby health.